So imagine your doctor has come to you recently to inform you that your kidney function just isn't where it should be. He mentioned the word dialysis, which gave you quite the scare. Actually, he mentioned 3 different options to help treat your reduced kidney function: kidney transplant, hemodialysis, and peritoneal dialysis. You've heard of hemodialysis, but you've never heard of peritoneal dialysis. So what is peritoneal dialysis? It's using the lining of your abdomen as a makeshift kidney. Basically, your kidneys function as your body's filter. They filter out toxins and waste from metabolism, and they also help excrete excess water and electrolytes. Basically, they maintain a balance in your body. Without it, you'll build up toxins, retain fluid, and build up edema. This eventually will lead to heart problems and even affect your brain eventually. Peritoneal dialysis can help avoid some of these situations. It uses a super concentrated fluid placed in the abdomen to help draw out excess fluid and toxins. Let's just show you how it works. A dialysate fluid flows in through a tubing and through a catheter that has been surgically placed into your abdomen. This catheter allows the fluid to flow in to your stomach. This fluid is called a dwell, and it usually consists of 1.5 to 3 liters. This dwell will stay in your abdomen for 4 to 6 hours. It's primarily made up of glucose, which is equivalent to sugar, and salts. These act like a magnet that helps pull toxins from your blood and into the peritoneal space, or the space in the cavity in your abdomen. Once this is done, the fluid can now be drained, as it is filled with toxins, into a waste collection basket that can then be discarded. New fluid is then instilled into the abdomen to continue a new dwell. You've completed one exchange. So, what are the benefits of peritoneal dialysis over, say, hemodialysis? Well, with hemodialysis, you usually go to a clinic 3 to 4 times a week. You need a fistula or an HD catheter, and you have to have 3 to 4 hours per treatment. With peritoneal dialysis, you usually can do this from home. You can do it at work or even when you're traveling. You usually have to do this 3 or 4 times a day, and the dwell is left in the abdomen. You do, however, need a peritoneal catheter. Talk to your doctor about what's best for you, though. With peritoneal dialysis, there's actually 2 different types. The first is continuous ambulatory peritoneal dialysis. This type of dialysis doesn't use a machine. An exchange lasts between 30 to 40 minutes, and the dwell remains about 4 to 6 hours. You need a minimum of about 4 exchanges a day, and you can sleep with the dwell at night, so you don't have to change it in the evening. The second type is automated peritoneal dialysis, or APD. This type does use a machine for its exchanges. Most of the exchanges occur during sleep, and you need 3 to 5 exchanges each night, and then you start with a fresh dwell in the morning. That can stay in all day. Again, talk to your doctor about what's best for you. So where do you begin? First, you would have to have a catheter placed surgically. Here's an example. This has to be done at least 3 weeks before beginning because of the time it needs to heal. Additionally, you will need some training. This training should be completed with family, so that way in case you need to be sick or otherwise, you can have help. This training will be with a dialysis nurse and be for 1 to 2 weeks. You'll learn how to do your exchanges and catheter care. So for an exchange, the supplies that you'll need are a transfer set, dialysis solution bags, drain bags, surgical masks, and an automated system will have more supplies. So step 1, you're going to wash your hands. Step 2, you will put on a surgical mask. Step 3, you will drain the fluid that is in your abdomen. Step 4, you're going to warm the dialysis solution. This can actually be done in a microwave or even using a warm breading kit if you don't have the wrappers still. Next, you will hang the bag. After that, you will flush the line with the solution to make sure all the air is out. Step 7, you will use the transfer kit to connect the tubing. This transfer kit will help to avoid infection. Step 8, you will clamp the drain and infuse the new fluids. Great job! You've now learned how you're going to do an exchange. Some changes that you may have to make with peritoneal dialysis are to your activity. Activity may be limited as there's fluid in your abdomen. Next, your routine may be limited as you will have to make time for your exchanges. Lastly, you may have to make changes to your diet, specifically to the amount of carbohydrates that you intake in a day, and to the amount of salt and phosphorus, as dialysis actually includes a lot of these. So intaking them through food will actually overload you. Some risk and side effects of peritoneal dialysis. First is the risk for infection. This is always a risk because you have the catheter in place. Proper catheter care and being as sterile as possible will help to avoid infection. Next is weight gain. There is always a risk for weight gain as the dialysis solution contains a lot of calories. If you follow the diet though, you will be able to manage this. This concludes our informational meeting about peritoneal dialysis. For more information, you can visit www.niddk.nih.gov.